the prosecutor in the New York District Attorney's Office just accidentally eavesdropping on Mangione's phone conversation with his lawyer. And now you get 120 pages of private medical information that you say you deleted, and now you're blaming the defense. Sure seems like there's a lot of things that could be used in a possible appeal if Mangione is convicted. Hey, it's Jordan with Status Coup.
This is Ashley with Status Coup.
On the ground.
In Philadelphia.
Flint, Michigan. East Palestine, Ohio. Please support the leading independent news outlet on the ground,
covering what the corporate media covers up.
Hey, it's Jordan with Status Coup. New York prosecutors going after Luigi Mangione, the alleged shooter of UnitedHealthcare CEO Brian Thompson, admit they did receive 120 pages of Mangione's private confidential medical records accidentally. But according to them, they did the responsible thing and immediately informed the court, Mangione's attorneys, and deleted it. That is their court filing on Friday. But first, if you don't know the story, let me share with you what Mangione's attorneys alleged in a recent court filing. I covered this about a week or two ago. Attorneys for Mangione, the man accused of killing UnitedHealthcare CEO Brian Thompson, say Manhattan prosecutors wrongfully obtained his medical records. Mangione's attorneys claim the Manhattan DA's office improperly compelled Aetna to turn over confidential information in violation of health privacy laws. Quote, the district attorney falsely made up a court date, May 23rd, 2025, and drafted a fraudulent subpoena that if Aetna did not provide documents on that date, it would be in contempt of court. Mangione's attorney, Karen Agnifilo, wrote in a letter to the judge. Because the district attorney has taken possession of and at least partially reviewed Mangione's confidential doctor-patient privilege and HIPAA-protected medical records, and further because the district attorney misused the subpoena process to obtain these protected records, this court should impose an appropriate sanction after conducting a full evidentiary hearing to uncover the extent and nature of the significant privilege and HIPAA violation intentionally caused by the prosecutors. Sources in the Manhattan District Attorney's Office say it requested limited information, but Aetna sent them additional materials in error, and that it deleted the materials as soon as they became aware of them. Okay. So now we have a court filing. This was from Friday from prosecutors in New York District Attorney's Office that are going after Mangione. Again, the next case, the next court hearing in the New York criminal case against Mangione is on September 16th. We plan on being out there to cover it. Again, we are leading the coverage on this story, and broader than Luigi Mangione, the predatory for-profit murderous health insurance scam killing millions of Americans. So please support Status Coup as a paying member if you can, for as low as 16 cents a day. That's $5 a month. We really, really need to grow and keep growing our paid membership to continue funding the on-the-ground reporting, which is expensive. I will read to you some of the prosecutor's claims that it was all an accident, just like apparently it was an accident that they eavesdropped on private phone calls between Mangione and his attorneys. Given these circumstances, defendant's real complaint is not about the subpoena itself, but about Aetna's response to the subpoena, which included documents that the people had not requested. When the people, by the way, 120 pages of his confidential HIPAA-protected medical information. Aetna just accidentally sent that? That would be quite an accident. When the people dutifully alerted Aetna that it had sent material that exceeded the scope of the subpoena, Aetna submitted a new response containing only the information we requested. That information consisted of nothing more than the defendant's account number and dates of coverage. Defendant cites no authority to support his complaint that the District Attorney of New York was required to obtain a so-ordered subpoena to request that limited information. Defendant's claims of the people's, quote, fraudulent intent are baseless. In the course of any court proceeding, mistakes do occur. Well, there's been a whole lot of mistakes, and they all just happen to be an invasion of Mangione's privacy, his private communications with his attorneys, among other things. Indeed, Aetna erroneously sent us materials that exceeded the requests set out in the subpoena. We undertook the appropriate measure when we realized the error. Like Aetna, the defense then erred. Compounding Aetna's mistake, defense counsel sent the people an email attaching the entire Aetna file, she now complains about. Once again, we complied with our ethical obligations by asking counsel if she intended to send us the file. When she indicated that she did not and asked that we delete it, we complied with her request and did not take advantage of her error. Thus, on this and all occasions when errors were made by defense counsel and by Aetna, the people acted ethically to alert the court and counsel. Well, I'm not a lawyer, but I watch Law and Order, and it sure seems when there's so many errors, like the prosecutor in the New York District Attorney's Office just accidentally eavesdropping on Mangione's phone conversation with his lawyer, and now you get 120 pages of private medical information that you say you deleted, and now you're blaming the defense for sending you that information after Aetna accidentally. Sure seems like there's a lot of things that could be used in a possible appeal if Mangione is convicted. I'm just saying, whether you support Mangione or not, I mean, kind of black and white. There's a lot of unusual, abnormal things going on in the case of Mangione, not just in the New York State case, but the federal case as well. I have reached out to Mangione's attorneys to get their response to the prosecutor's claims that they only asked for his Aetna ID number, the length of time he was on Aetna, which, by the way, I'm pretty sure is also HIPAA protected, both of those factoids. And Aetna just clumsily sent 120 pages of private medical information. I mean, Aetna's might be corrupt and another for-profit predatory health insurance company, but sure seems odd to me that they would, unprompted send his whole medical filing if they were not asked for that, either in writing or, through back channels, were asked for his whole medical information. By the way, Mangione's attorney, Karen Agnifilo-Friedman, she's not exactly an amateur. She was, I believe, number 2 at the New York District Attorney's Office. She was a chief assistant district attorney. So the accusation from the New York prosecutors that Agnifilo and her defense team accidentally sent the prosecutors Mangione's medical records after Aetna accidentally sent them, I don't know. Somebody's lying here, and I have a hard time believing the former number 2, a very high up respected lawyer, is the one who accidentally sent to prosecutors all his private medical information. You be the judge of that one. But again, there's a whole lot of accidents happening here. And by the way, why would the prosecutors need to know Mangione's ID number with Aetna, the length of time he was on Aetna health insurance? I mean, why would that be pertinent to the crimes that they are alleging he carried out? It all seems very perplexing to me. I did reach out to Mangione's attorneys to get their response to the claims by the prosecutor. They declined comment. That doesn't mean they're not going to respond. And judging by the amount of court motions they have filed, it would be my strong hunch that they will be filing a response to this in court pretty soon, possibly this week. And again, somebody's lying. Somebody's lying. I am going to err on the side that the prosecutors are lying because they're the ones who keep benefiting from the accidents that recurringly keep happening. So we will keep you updated on that. I'll put the link to the court motion in the description if you want to read along. I also want to update you if it wasn't bad enough. All the stock buybacks UnitedHealthcare and other predatory for-profit health insurance companies are doing, I'd like to remind you, I covered this a couple weeks ago, but UnitedHealthcare is now essentially apologizing to its investors for spending too much money on health insurance, on health care. UnitedHealthcare CEO Tim Noel offered investors a deeper look at the medical cost spike that's plaguing the insurance giant's finances. He said during the company's earnings call Tuesday, again, a couple weeks ago, that pricing assumptions set by the company, quote, were well short of actual medical costs for 2025. UnitedHealthcare's current outlook, he said, instead reflects an additional $6.5 billion in medical costs, with more than half, or about $3.6 billion, coming from its Medicare plans. About a third of the expense, or $2.3 billion, is from the commercial space, quote, with an even split between the cost pressures in the Affordable Care Act's marketplace and the employer-sponsored space, Knowles said. Quote, we know these are serious challenges, he said. We are humbled by them and will carry that sense of humility more deeply into our culture. But we also believe we could resolve our current issues and recapture our earnings growth potential. We are humbled by these challenges of spending a little too much money on providing health care. The bulk of the increase in spending is in outpatient care, though the insurer is seeing spikes in inpatient care, orthopedic services, and pharmacy infusions to a lesser extent. Visits in general are being coded at a higher intensity. Knowles said a trend that bears out across the country and UnitedHealthcare's membership. Noel also offered a look at how the insurer is responding to the, quote, high-pressure environment, i.e. the having to spend money on actually providing health care. Sorry, folks. Sorry, shareholders. We spent too much. We'll start denying more. He said UnitedHealthcare has enhanced its auditing and payment integrity process to identify fraud, waste, and abuse while protecting patients from unnecessarily high costs. Oh, that's who I want. That's who I want. Auditing, waste, fraud, and abuse. UnitedHealthcare, who used AI, by the way, at a 90% error rate in denying claims. They denied claims at a 90% error rate. So that's who you want, auditing for waste, fraud, and abuse. The team is also looking to identify ways to deploy artificial intelligence to smooth out the patient and provider experience while also lowering costs. You wonder why so many people hate UnitedHealthcare. Gee, golly, gee. I think this tweet from Robert Reich adds a little illumination to UnitedHealthcare and its fraud. UnitedHealthcare is raising premiums for policyholders in New York and Washington after spending $9 billion on stock buybacks last year. Healthcare companies are robbing you blind to enrich their executives and shareholders. This is why we need Medicare for all. The Department of Justice under Trump is, according to news reports and UnitedHealthcare, investigating UnitedHealthcare criminally and civilly. I'm not going to hold my breath that any UnitedHealthcare executives going to jail for illegally denying claims that should have been approved through the use of AI and other fraud, including its Medicare Advantage fraud. They'll get a nice hefty settlement, big fine that they settle, and that'll be billed as some win for the American people by the Department of Justice. To be fair, this has happened under Democrats, where they give slap on the wrist to big pharmaceutical companies, fossil fuel companies, big tech, Wall Street banks, all of them. The Sackler family, who killed hundreds of thousands of people through OxyContin. When are people actually going to be put in prison for illegally depriving the human right of health care to enrich themselves in the form of stock buybacks, buying more yachts, and all the rest? Let me know what you think in the comments. Once again, we will be continuing to cover the Mangione case, particularly on the ground at the next court hearing in September. We're not expecting the actual trial to begin until early 2026, but we plan on being out there on the ground as well. It's expensive to pay reporters, cameramen, equipment costs. So please support us for as low as $5 a month. As far as I know, we're one of the only outlets continuing to cover this critically important story on the ground. Thanks again.